Tedizolid tablet is used to treat serious bacterial infections of the skin. It works by stopping the growth of bacteria. This medication treats only bacterial infections and will not work for viral infections, such as the common cold or flu. Using any antibiotic when it is not needed can cause it to not work for future infections. The usual dosage is once daily, with or without food. It is best to take it at the same time each day. Before you start taking Tedizolid, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food, as directed by your doctor, usually once daily. For the best effect, take this antibiotic at evenly spaced times and try to take it at the same time every day to help you remember. It's important to continue taking this medication until the full prescribed amount is finished, even if your symptoms disappear after a few days. Stopping the medication too early may result in a return of the infection. If your condition lasts or gets worse, make sure to inform your doctor. Side effects of Tedizolid tablet may include nausea, headache, and diarrhea. If these effects persist or worsen, notify your doctor or pharmacist promptly. Remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, such as a persistent sore throat, fast or pounding heartbeat, tingling or numbness in the hands or feet, changes in vision, easy bruising or bleeding, or unusual tiredness. Rarely, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. Contact your doctor immediately if you develop persistent diarrhea, abdominal or stomach pain or cramping, or blood or mucus in your stool. If you have these symptoms, avoid using anti-diarrhea or opioid products, as they may worsen your symptoms. Long-term or repeated use of this medication may result in oral thrush or a new yeast infection. Contact your doctor if you notice white patches in your mouth, changes in vaginal discharge, or any other new symptoms. While a serious allergic reaction to this drug is rare, seek immediate medical help if you experience symptoms such as rash, itching or swelling, especially of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects. If you notice any other effects not listed above, contact your doctor or pharmacist. If you are in the US, call your doctor for medical advice about side effects. You may also report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, call your doctor for medical advice about side effects. You may report side effects to Health Canada at 1-866-234-2345. If you are allergic to Tedizolid or have any other allergies, talk to your doctor before taking this medication. It is important to discuss any inactive ingredients that may cause allergic reactions. Also, inform your doctor of your medical history, especially if you have a low white blood cell count. Tedizolid may affect the effectiveness of live bacterial vaccines, such as the typhoid vaccine. Make sure to inform your healthcare professional before receiving any immunizations or vaccinations. Before undergoing surgery, let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, Tedizolid should only be used when clearly needed. It is important to discuss the risks and benefits with your doctor. It is not known whether this drug passes into breast milk, so consult your doctor before breastfeeding. Always follow your doctor's recommendations for the best time and dosage of Tedizolid. When taking Tedizolid tablet, it is important to be aware of potential drug interactions that could impact how the medication works or increase the risk of serious side effects. It is essential to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is crucial to always seek your doctor's approval before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Tedizolid tablet and is experiencing severe symptoms such as loss of consciousness or difficulty breathing, it is important to seek immediate medical attention. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. It is important not to share this medication with others. It has been prescribed specifically for your current condition, and should not be used for another infection unless directed by your doctor. If you happen to forget to take a dose of Tedizolid tablet, you can take it as soon as you remember, unless it is less than 8 hours until your next scheduled dose. In that case, it's best to skip the missed dose and just take your next dose at the usual time. It's important not to take a double dose to make up for the missed one. Make sure to store Tedizolid tablet at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When you no longer need the medication or it has expired, be sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. And remember, never flush medications down the toilet or pour them into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.